And we're live. Welcome back. Back again. Vitality Live, Friday afternoon, May 25th. Are we the 25th today?
Yes.
All day?
Yeah.
For our second edition of the 4-week running series. So today we're going to be talking about
running injuries.
Running injuries. All right. Last week, what did we speak about?
Running biomechanics.
Biomechanics. We talked about shortening your stride length.
Yeah.
We talked about increasing your cadence. I guess they kind of go, all three kind of go together, right?
And running as light as possible.
As light as a feather, right? So those are, hopefully, some of you have tried those techniques out and you were successful with them. As Val explained last week, you really want to start slow. You want to implement these new techniques at the start of your run, and gradually throughout or over time, you'll be able to use them throughout your run. So. All right, today we're talking about common running injuries. So we're going to keep it short and sweet. We have, again, this is part 2 of our 4-part series leading up to the run in Pointe Claire. When's that run happening?
The 17th, I think.
June 17th, Pointe Claire Village. Pointe Claire Village is a happening spot.
Where we'll be moving to?
Where we will be moving to, yes. So we're excited about that. So, let's do it. Common running injuries.
Well, we can start from the bottom up, I think.
Let's do it. Bottom up.
So first we have the most common, because you can have many, many, many different running injuries. But we'll start with, I guess, plantar fasciitis.
Plantar fasciitis.
So
awesome. So what is that? What's plantar fasciitis?
Well, itis, you've done a talk about this, right? What itis means. So it's an inflammation. So what's our plantar fascia? Well,
plantar fascia. So this is the fascia of your hand. Well, you have the exact same fascia on your foot. And it connects the forefoot to the hind foot, and helps with the arch support system.
Yeah.
It helps with connect the muscles.
It's very supportive. It doesn't have any contractile properties because it's not a muscle, but it definitely helps support all the structures on our underfoot.
Underfoot, yeah, and it's dense tissue, and it's there. It's there.
Thick.
It's thick. It's there. Thick. It's there to. It's connective tissue. It's there to connect. It's there to protect. It's there for a number of important reasons, and sometimes it can become
irritated. And inflamed. And and it's really not comfortable, usually, I mean, symptoms is mainly when you wake up in the morning, right? Taking your first steps are pretty tough. And why do they happen? Well, usually it's because people do too much too fast, and your foot's not ready for it, or weaknesses in your feet, right? We have little muscles in our feet that can definitely have an impact on, our stability.
So fasciitis, it's pretty common actually. A lot of people suffer from plantar fasciitis.
Yes. Not necessarily only runners either.
Not necessarily running, right? So it's very painful and can be debilitating.
Mm-hmm.
Number of patients we treat have had it over some people get it often, and
on
it goes away for a
yeah.
bit, comes back, and again it's really based on biomechanics. So you're overloading the tissue where it attaches, most commonly at the calcaneus, the insertion of the heel. And a good way of of showing what happens is, imagine like your callus, right? When you work out, you get a hardening of the tissue. So it's a similar process that happens based on inflammation. So it's loading of that tissue over and over, pulling that irritates and results in plantar fasciitis.
Exactly.
So what can we do to help prevent it?
Rolling on a ball.
A
hard ball. I think, we have lacrosse balls here, but if it's super inflamed and it feels very throbby, what you can also do is plan ahead, and you can freeze a water bottle.
That's awesome.
You can freeze a water bottle so it has the cooling effect too, but if it's just, if you just want to release it and it's not necessarily throbby, you can just use a normal ball and you just roll your foot on it. You can usually, be either sitting or standing. This
little ball is such a useful tool, right? You can use it both preventatively and right.
Well, if you think about it, people who are up on their feet all day as well, you need to give your feet a break, or you need to give your feet a little bit of TLC and help release it. So it's a good preventative way.
Yeah, so many receptors in the bottom of your feet. There's a whole study or practice called reflexology, which ties different areas of the body to the feet. So just give yourself some TLC, a little bit of this daily, nighttime before bed, especially if you're suffering from fasciitis. at the end of the day, really go to town on this bad boy right here.
Yeah.
It helps so much. It's crazy what release can do. So you can use a lacrosse ball, a frozen water bottle, a golf ball, a tennis ball if you're really inflamed. You can start mellow and then work your way up to this guy.
A rolling pin.
A rolling pin. They have balls with spikes on them.
Yeah.
There's all sorts of but there's all sorts of them, right? And the main idea, the main theme is just do a little bit of self-care, a little bit of self-love on the feet with these tools, right?
Yeah. There's also little feet strengthening exercises that are less evident, I guess, as doing a bicep curl. So strengthening the little muscles in your arch. So that we can go into depth about that, but I usually hand people even sheets about it because it's tough to remember.
Yeah.
But you can actually control your arch. You can control the muscles in your arch, which is an interesting thing.
Yeah, I think I'm a huge believer in this whole return to the natural footwear or the barefoot movement, but it takes a lot of time to get back there.
Yes.
And so we'll talk about that at a later date.
Yeah.
But like Val said, all those little intrinsic muscles of the feet are so important. And usually what happens from a young age, unfortunately, is we jam our feet in shoes, right? Somewhat to protect our feet from the concrete jungle we live in, but we jam our feet in shoes and women more often than men in the pointy shoes that kind of cram all your feet together. Men too, though, in dress shoes, right?
Shoes are very important for the outfit.
They are very important. But what happens is we actually lose a lot of function of our feet over time. And this, again, takes us back into why we could have biomechanic problems or issues with gait, all based on us losing touch with our feet. Our feet are so important to the body proprioceptively. Yeah. So much information from the ground up comes from our feet, and when we jam them into shoes, we lose that feeling or that.
So also, actually, walking bare feet can prevent to have these foot issues because it comes to strengthen all the little feet muscles and the day to day. The only issue is, let's say you are suffering from plantar fasciitis, walking barefoot can actually be more of an irritant.
Exactly.
So you slowly want to ease your way into it. You don't necessarily want to go directly to walking all the time barefoot.
Awesome.
In your home, obviously, because if you go out in public, it's usually best to wearing footwear. But
sand, right? Walking the sand, walking the grass.
It's very tough.
Yeah, walking the sand, walking the grass, so all that, and that is very important. All right, what's our next injury we're talking about?
Achilles tendonitis.
Achilles tendonitis. So that is directly
an itis,
right? An inflammatory thing. So
inflammation of your Achilles tendon.
Yeah.
What is that?
So what's the Achilles tendon, Val?
Well, the Achilles tendon is actually the tendon that ties up to two of your muscles and ties up to your heel. So it allows you basically to go on the tip of your toes, and it ties your gastrocnemius with your soleus muscle. Most people know what the gastroc is, right? It's the most external muscle of your calf, and then the underneath muscle called your soleus. And those two merge together, form the Achilles tendon and tie up to your heel, and allows you to go on the tip of your toes.
Mm-hmm. So what happens there? Where typically would someone feel?
Right on their Achilles tendon, so basically under the muscle belly, right up until the heel. And often if you compare one side to the other, if it's been irritated for a while, there'll be a lot more thickening.
It's like a lump,
thick.
like a fibrotic area, right?
So a lot of scar tissue can form, and you just really want to get rid of that scar tissue, so you got to work on it.
So the reason why your body does this scarring is actually a protective mechanism. So it's trying to compensate. It's trying to say, you're pulling too hard right here. I'm going to lay down some tissue, right?
Yeah.
And the same concept as the callus, right? We talked about that. It's called Davis's law. So where there's a stress, your body will respond to that stress by trying to strengthen the area. But unfortunately, it can create a lot of
pain.
Right?
Same kind of thing in the morning usually can be the worst, and often it's again about doing too much too quick. So for using your muscle too much, or if you have too much muscle tension built up in your calf, it can start pulling on that tendon and creating some irritations there too.
So what are some things that someone could do to help prevent or help treat? Just some at-home care stuff.
Well, help prevent, you can definitely roll your gastrocs and your soleus. Awesome. So your calf, you want to roll your calf. You want to make sure that your calf muscles are always nice and released, nice and comfortable, that there's no huge pressure points and there's not continuous tension on that on that tendon, I mean, in order to treat it, you definitely want to work on that fibrotic tissue, and you want to get rid of it. And along with the fact of making sure that your leg is in the most optimal environment. So you want to release that calf as well.
Awesome.
You don't want to stretch too much your calf muscles. Getting a nice comfortable stretch is okay, but you don't want to stretch them too much, because your calves are really important when running. They're really your springs, so they need to grasp that energy, and you use it to let go with every step, if that makes any sense, right? So if your calf is way too flexible, you're not gonna the pattern of running is not going to be as efficient, and you're not going to be able to release that energy. So I don't always suggest a bunch of stretching depending on how flexible your calf muscle is.
Okay, cool. Which reiterates why it's important to come see someone like us, right? So to evaluate your gait, to evaluate what is actually going on, what's causing the problem, right? Because a lot of these things can be caused by different reasons, right?
Yeah.
So biomechanical issues, overuse issues, muscle weakness, right? So it just reiterates why it's important to come see someone like us to have it evaluated. There are lots of things you can do at home, but always keep in mind that it's really important to see someone.
It's very individual.
Very individual, right? No two people move the same. No two people, their genetic makeup.
Yeah, if you watch people running, I mean, sometimes you wonder, how is this person not in pain? But, it works for them.
Exactly. So, all right, moving up the body. What's our next injury we're talking about today?
I mean, we also have in the calf area shin splints, and shin splints is a huge umbrella term that just means pain in the shins.
Yeah.
Right? So, often that's caused due to imbalances muscle-wise in the area, and tightnesses. Shin splints can also be an umbrella term for a slight stress fracture.
Stress fracture, right? Periosteitis, right?
Yeah.
Like all little things that happen at the anterior compartment of the leg. So why do those happen? Right?
Why?
Well, give us some reasons.
Too much too quick.
Okay.
Muscle tightness, weaknesses, overcompensations.
We often see them.
Poor biomechanics.
There you go. I often see them too. If someone a change in shoe, right?
Yes.
So adapting to the new shoe, right? The new shoe environment. Change in surface. So someone who runs trails all the time, then they go start running on cement.
Yeah.
Like, ooh, wow, my shins are fired up. So again, there's a whack of reasons why this could happen, but they do happen. So if you ever suffer from pain in the anterior compartment, come see someone. Go see someone. So one of the really good exercises for that actually is that towel one. It's good for general foot, but where you throw a towel out on the ground, and using your foot and the arch of your foot and your toes, you scrunch that towel back up towards you, will help actually activate that anterior compartment of your shin. You have anything else?
No. What's the next one?
IT band syndrome. Let's go up the knee. Or we want to do knee?
Well, either or. Okay. We're at the knee.
Okay. So what do we want to do?
Well, what is an IT band syndrome?
What is an IT band syndrome?
Most people know what their IT band is, right? Which is a long fibrous tissue along the side of the leg, of the thigh. There's a little muscle up top that ties up to it called your TFL. And it basically ties up to the outer part of your tibia, on the outside
hip
of your
knee, right?
Yeah, hip to knee. And often what happens is rubbing builds between that fibrous tissue. It's not really a tendon, it's a fiber.
It's crazy. It's like super, super dense, super tight.
And it rubs on the bone and creates some inflammation, right? So again, what could be causing that?
Helps with lateral stability.
Yeah.
Okay. What could be causing that? We come back to biomechanical issues.
Yeah. A lot of weakness is actually in the hips.
Right?
A lot of weakness.
Med.
Yeah.
So knee tracking in, right? You'll see a lot of this, not typically in women, but in women who have a larger Q angle. Right?
Yes, Q angle is just basically the angle between the hip and the knee.
Hip and the knee.
Right, so the wider your hips and the knee goes in. Yeah.
It's there biologically and genetically for childbirth, which is one of the reasons why there is a larger Q angle.
Yes.
Men are made a little bit different from women. And what that does is it actually puts a little more force or stress on the knee as the knee comes in. So you really need to strengthen your external rotators. Right. So learn how to squat efficiently. There's people you see now. It's actually pretty popular now. You see people with those mini bands that'll do those exercises to help activate the glutes, the external rotation. So that's a way of preventing. Right. IT band syndrome. It's also a way of treating
and rolling. Right.
Rolling. Right.
Always coming back to rolling.
Yeah. Rolling the hip, rolling the muscles around the knee.
The IT band itself.
The IT band itself, releasing the pressure there.
Yes.
Awesome. Now what are we at?
Runner's knee.
Runner's knee. All right, Val.
Also called patellofemoral syndrome, but a lot of people prefer calling it runner's knee. But actually, patellofemoral syndrome, it's what the name says what it is, right? So your patella, which is your kneecap, and femur is your thigh bone, right? So it's the rubbing between the kneecap and the thigh bone, the femur, that creates that irritation, and usually you have that pain underneath the kneecap. It's like a deeper pain. And it's when you go from your leg being straight to bent to straight to bent, you're doing a bunch of repetitions, and it's the kneecap not moving properly and creating constantly a friction. And that's basically what it is. Mm-hmm. So again, what can be causing that?
So all of these issues, right, we're going to sound very redundant, but they can be addressed, treated, prevented through improving the way you run, addressing your biomechanics, looking at your footwear, working with someone, doing some foam rolling, doing some exercises which are going to help strengthen muscle weaknesses, working on areas that may be tight or inactive. Right? These are the things that are going to help you run for a long time, going to keep you injury free, or help you recover from injury.
And it's important to remember that running is a very repetitive sport, right? You're constantly doing the exact same thing. So if you have a weakness or tightness or something somewhere, most probably it'll pop up.
For sure, right? I think this is insane. 72,000 steps on average in a marathon, right? 72,000.
Yeah, but I mean, not everyone do
exactly right?
marathons.
But that's insane. Like, that's a lot. So think about that. But then think about the training involved with anything, with preparing for a 5K, right? So there's a lot of room for error, especially if you're doing it over and over and over again. That's all I mean. A lot of duty cycles, right? A lot of repetition. 72,000. Correct me if I'm wrong, but apparently I read that somewhere, and it just popped up somewhere.
A full marathon or half a marathon?
I think it's full. I think it's full, but maybe it's half. I don't know. Anyways, it was buried deep somewhere in my brain. It just popped out. So thank you so much for tuning in. There are a bunch of other injuries that are associated with running as well.
I mean, low back, muscle strains,
stress fractures,
metatarsalgia, which is
exactly
irritation of your bone, the bones in your foot.
So there's a whack of other ones that do come along with running. The most important thing is go see someone if you're hurting,
or even if you're feeling something is off, right? Yeah. Better treat it as soon as pain's the last thing we feel, so it means you're compensating way before you feel it.
We feel, here we are advocates of prevention. That's the way we like to practice. So go see someone, even if, like you say, you might think your biomechanics are off or whatever. Or
you just want to better your running technique.
Yes.
Or you want strengthening exercises to support your training program, right?
Awesome. Thank you so much, Val, for co-hosting again with me. We'll be back next week. Next week, we're going to talk about, we're going to get into that controversial subject of footwear and this whole barefoot running movement, because I think it's pretty important, evolutionary, and I have young kids now, so I'm trying to keep them more towards because their feet have not yet developed, right? So I'm trying to keep them as barefoot as possible. I'd love to dive into that next week. What do you think, Val?
Sounds good.
Let's do it, because that as well. So there's a lot of injuries that have come from this movement as well, because people have been used to running in certain shoes for a long time.
Well, our biomechanics is based on it now, right? If you grow up with something, you've adapted to something, right?
Yeah, so there's a lot of controversy around this subject. I think it is a good movement. I think if done well, and if incorporated and done with the help of professionals, it is very beneficial to your entire body. So we'll dive into that. Sound like a plan?
Yeah, sounds good.
All right. Thanks so much for tuning in. We love all you guys. Have a wonderful weekend. Get out and run, and we'll be back next week.